my name is Shannon Fanenstein. I'm a representative with Mazan Medical. I am here today with Chief Medical Officer, Dr. Mike Bradley. And today we are going to discuss what the differences are between the Uroval BRS screening versus urodynamics. So I would like to introduce Dr. Mike Bradley.
Hello, I'm Dr. Mike Bradley, PhD. It's very nice to meet with you and talk about this very interesting subject. We get this question quite a bit. So I'm the Chief Medical Officer for Mazan Medical. Mazan Medical represents a system called a Uroval. And a Uroval is a nerve testing system that sometimes gets confused with urodynamics. So the question comes up a lot from our doctors and the people that are looking at this product. What's the difference between the two? So let me start off by talking about what a urodynamic study is, a UDS study is. And it's a test that it kind of explains how well the bladder, the sphincter, and the urethra hold and release urine. The test can show how well the bladder works, whether or not there's leaking or blockage at a certain point. It can tell us how much urine the bladder holds at different levels of that person's sensational awareness, whether or not they first sensational feeling of it, or whether or not they're at maximum capacity and they need to find a bathroom as fast as they can. And then a part of that study also allows them, once we've filled up the bladder with a certain amount of fluid, it also lets them to void that bladder and see if the same amount of fluid that we put into the bladder is what comes out. That's when we talk about urinary retention and blockage and things such as that. So it's a very great test. It gives us a lot of information, but it's actually one word that represents probably closer to 5 different things that we're doing on a patient. We're artificially filling up the bladder. We're checking EMGs and muscle movements at the same time. We're voiding the bladder, so we're doing something called a uroflow. We're doing leak point pressures. All of these are different tests that occur in that 30-minute process of doing a urodynamics test on a patient.
And that sounds a little messy and uncomfortable.
Yeah. So, so let's get into let's call it the pros and cons of urodynamics. So the purpose of the urodynamic testing is to identify and quantitate the different factors that are associated with voiding dysfunctions, right? Bladder, pelvic health, pelvic floor, and the urethra, right? It's mildly discomforting. It causes soreness. We're placing a couple of catheters into the bladder, and we're artificially filling up the bladder. So right off the bat, you can see how that would be, let's just say, uncomfortable. When I used to do it, it was very common for us to go ahead and just prescribe an antibiotic for UTI, because we're generally going to be causing one because of what we're doing to be able to get this test completed. It also required a high-level provider to do the catheterization. And in certain states, we have an organization that goes around, and these nurses will do this that are trained specifically for that. So it's not something that your MA, your medical assistant, or your PA, your physician assistant, it's not something that a low-level person either would be comfortable doing or really should do, if that makes sense. So it requires a little bit of
potentially cost a practice a little bit more money as well.
It's definitely eating up the time of a high-level person. That's 100% true. And we're talking 30 minutes of eating up a room and that high-level professional, because you can't just turn on a machine and leave the room. You got to be there the whole time.
Okay.
The urodynamics test is, like I said, it's many procedures all in one. And when you're looking at it at a billing kind of a setting, a lot of times insurance companies are really good about halving different procedures as you're going down the CPT road. So it's a bit complicated. It also requires it almost requires really 3 visits. The first visit to determine that you need to do a urodynamics test, and then there needs to be a completely different visit so the doctor can give you the results and the expected treatment based on the urodynamics test. So it's really 3 visits, and we see a high level of no-show, because when people Google what's a urodynamics test, it's pretty invasive, and we get a lot of people that say, I'm not going to do that. All right. So now let's talk about that. Makes sense, right? That's urodynamics. It's a lot of tests to figure out really the muscle and pressure situation of the bladder. The Uroval is not a urodynamics test, nor should it be done in the same setting as a urodynamics test. It is a test that does something that we call BCR for short, and that's Bulbocavernosus Reflex test. A bulba cavernosa is nothing more than a reflex nerve test that's associated with your pedonal nerve, which controls the urine and the fecal situation that occurs in your pelvic floor. It's a nerve test. Now, the traditional way of being able to do this was actually a little bit painful. It was very invasive. Sometimes they used needles, just not so good. So a really smart woman decided to invest and invent a way of being able to test the nerves of our bladder without needles and painful situation, and do it in such a way that it was billable, so that it made sense for the doctor to do it anyway. But it allowed for us to be able to get that very valuable information of whether or not there's nerve damage causing the problems that a urodynamics test can show. So in a way, the urodynamics test isn't really showing the source of the problem, it's showing the symptoms of the problem. Whereas a Uroval or BCR is showing us potentially the source of the problem, which is nerve-related injury.
Yeah,
right?
and I love your little poem of the S2, S3, S4 helps keep the poop off the floor. And when I mention that to anybody in the medical profession, the light bulb goes off.
Yep. Because they heard it probably in medical school. That's where we teach it here at UNLV Medical School. Is they were the ones the students were the ones that came up with that S2, 3, and 4 keep poop off the floor. So it's one of those deals where it's like it's clearly necessary. The symptom is the poop on the floor, right? But the cause is those nerves in that lower back specifically.
And can you explain, compared to urodynamics, how quick and easy this test is and how it's non-invasive, non-electrical, and a patient shouldn't be fearful of having the test done?
So a BCR done with a Uroval system that we're lucky enough to represent, it emphasizes the nerves of the pelvic floor. It is beneficial in determining sacral nerve dysfunction, which can allow us to be able to direct our treatment path to something that's more likely to work. It uses a little EMG stickies around the anal sphincter for measuring the anal wink, which is how we're able to test the reflex. It uses a non-electrical mechanical stimulation. It's just a tap on the outside of the body. And, it has no discomfort, no side effects, doesn't require the antibiotics that we talked about, non-invasive, and it can help determine the side of the body that the nerves might be, because that can direct us with something called PTNS to help be more efficient in our treatment. So that's basically it in a nutshell.
So Dr. Mike, exactly how is the screening done of the Uroval with the patient?
So there's a couple of things, like when we're looking at the difference between, of course, urodynamics and with Uroval or Bulbocavernosus Reflex. I talked earlier that with a urodynamics test, you actually have to kind of do 3 different, visits. A visit to talk about the urodynamics and schedule it, an actual urodynamics visit, and then another visit to actually discuss what the results were. Well, the Uroval or the BCR, the Bulbocavernosus Reflex test, doesn't require that. It's really nice because it doesn't require a patient to have like a full bladder. You can do it as a part of the initial assessment or the yearly annual evaluation of your patient, as a part of generalized screening for the patient to see how their nerves are functioning. And it can be done in a normal office visit. So within a normal office visit, you're allowed to do this test, because it's not a procedure. It is more of a, like you said, it's more of a screening. So that's the separation of the difference, and allows us to be able to do this test, no different than when we do a blood pressure test or something like that when a patient comes in to see us. The difference is we're allowed to bill for this test, and it gives us very clear, instant information to be able to make good clinical decisions based on urinary incontinence or ED, for different men that have neurogenic ED, or fecal-based issues. It can give us very clear diagnostic decision making at the moment that the patient's there, so we don't lose them. So that's why I like it.
Some of the important information I know that we have that comes from this is we are able to determine what side of the patient, if somebody were to have to go see a urologist and have something like an E-stim placed, and is that correct?
Yeah, it's really handy for that. We had a doctor who did a study who was able to individually identify 24 nerve roots within the pelvic floor. He was a neurourologist. But for a more simplified version, we can tell if the nerve damage is on the left side of the body or the right side of the body. And based on that, we can tell, people that do something called PTNS, should they use their left leg or the right leg, instead of, alternating, to be able to really give the damaged nerve the attention that it needs and stay away from nerves that aren't damaged when we're talking about electrical stim therapy and modulation.
Okay, that's great. Anything else you'd like to add?
It's a very, very fast test. My MAs do it, which is perfectly allowed because it's one of those, level 2 tests that just simply has to have a doctor in the facility, for supervision purposes. So it doesn't require that advanced training that we talked about for urodynamics. And it gives us a clear understanding of what's actually happening and maybe what the source of the problem is. So in my opinion, it's a better test to do than a urodynamics test that has all of the flaws that we talked about earlier. So it's worth taking a look at.
Yep, and for the patient, quick, easy, non-electrical stimulation, non-invasive. It sounds like a win-win to me. So I
Pain-free.
really appreciate your time, and thank you out there for joining us. And don't forget to like and subscribe. If you have any further questions, please click on our link, and that way you can contact us. Have a great day.